Hello students, I am Dr. Nidhi Gupta. I am a faculty at the Center for Population, Health and Development, School of Development Studies at Tata Institute of Social Sciences, Mumbai. I welcome you to the module on Health Technology, which is a part of Population and Health paper. The main objectives of this module is to introduce the concept of technology for the provision of healthcare both at the individual level as well as to improve population health outcomes. We will also discuss the World Health Organizational framework for health technology assessment, and we will also discuss the highlights and the debates around the health technology and its implications on the cost of care. Let us begin with the definition of health technology. The World Health Organization uses this term health technology to refer to the applications of organized knowledge and skills in the form of devices, medicines, vaccines, procedures and systems developed to solve a health problem and improve the quality of lives. Hence, the phrase healthcare technology not only refers to the physical parts of the hardware of WHO definition that need to be maintained, but also the drugs and pharmaceuticals which are usually covered by separate policy initiatives, frameworks and various departments. Health technology is usually used interchangeably with healthcare technology by various researchers as well as in various policy documents. Health technologies are essential for efficient functioning of health system in today's dynamic scape of health conditions and outcomes. Medical devices in particular are crucial in prevention, diagnosis as well as treatment of illnesses and diseases as well as patient rehabilitation. The World Health Assembly adopted the resolution in its 60th Assembly which was held in May 2007 in order to recognize this important role of health technologies. The resolution covers issues arising from inappropriate deployment and use of health technologies and the need to establish priorities in the selection and management of health technologies, specifically for medical devices. With this resolution, the importance of health technologies was acknowledged by the member states for achieving health-related developmental goals, and it also urged expansion of expertise in the field of health technologies. Three aspects of health technologies were highlighted in the World Health Assembly resolution that are essential to harness the benefits of technology in improving the health of population. It is the appropriateness, efficiency and usefulness derived from the application of engineering methods, devices and informatics in medicine and with respect to public health. Now let us look at the situation of policy on health technology. We will look at both the global scenario as well as the scenario of policy on health technology in India. Around the world, about 1/3 of all the countries, that is about 35% of the 174 member countries, have a health technology national policy that is a part of the National Health Program, while 12% have an independent policy document on health technology. However, in India, as of now, there is no specific national policy on health technology. Though there is a Central Drugs Standard Control Organization which is responsible for implementing and enforcing drug regulations in the country. This clearly shows that though there is an increasing diffusion of technology in healthcare in India, the same is not regulated or guided by any policy framework, which demands urgent attention of the policymakers. Now, let us look at the use of health technology to improve health outcomes. Health technology may be utilized to improve health outcomes at both individual as well as population levels. Utilizing technology as a part of broader effort to improve health outcomes beyond the individual patient requires the adoption of the population health approaches. Population health is defined as the health outcomes of a group of individuals, including the distribution of such outcomes within a group, and includes health outcomes, patterns of health determinants, and policies and interventions that link these two. Population health approaches provide an opportunity to improve the health of populations that are defined by geography, conditions, or health needs. Such approaches are people-centric and engage sectors beyond healthcare and incorporate the localized realities of the determinants of health, such as social and economic circumstances at the community level. Incorporating the use of technology within the population health approach requires an understanding and acceptance that people come first and technology second. Placing people first drives efforts to identify and leverage the strengths and assets within a targeted population and pay attention to health through a socio-ecological lens. It enables the development of partnerships and sharing of resources and data during all phases, identifies the most appropriate technological strategies based on population feedback, and aids in process of continuation of learning for both health system stakeholders and the targeted population. Placing people first yields information on the most effective processes for sharing knowledge and timely information when required, and supports systems and processes that intertwine knowledge, behavior, and action within the context of the local environment. It facilitates a better understanding of how the social ecological context shapes health outcomes and the delivery of services. It also helps pinpoint opportunities for investing in structured upstream and midstream interventions across different sectors with the goal of improving health outcomes. Now let us look at various levels and the involvement of various stakeholders for implementation of health technology. Health technologies may be used at various levels based on the purpose of the use of technology, like decision making, prevention, or cure of a disease. The utilization also varies on who uses the technology. For example, healthcare providers will utilize information from diagnostic techniques or equipment to improve the accuracy of diagnosis in order to understand the prognosis of the disease or prescribe the accurate treatment. Now let us understand how technology facilitates decision making of healthcare providers. Technology facilitates in analyzing the patterns, trends of diseases among a large group of patients and their associations with various socio-demographic, health-seeking, and other factors. Technology helps providers to gain insights that reveal which group of patients are improving and why, and which patient's condition is worsening. Based on this information, physicians can make better decisions to improve outcomes among a larger group of patients and scale population interventions. Health technology can also be used for analytics. Physicians can rely on emergency health records, usually called EHRs, and claims data to perform many tasks such as identifying the best patients for intervention. Another benefit of technology is that population health programs are tied to a series of matrices that reveal gaps in care as well as provide certain quality matrices. By evaluating the data, physicians can better understand how their practice is performing and make changes to improve their care treatment plans. Software that track social determinants of health, behavioral health, and other non-clinical drivers of health and diseases are also being introduced to gain a fuller picture of a patient's well-being. Technology that supports care pathways. Increasingly, software tools are being used to manage patients' adherence to everything from taking medications to remembering their appointments. For example, a diabetic patient that forgets to take their medication on time will receive a text message every morning instructing them to take their pills. These reminders could be set by the patient or at the physician's office, where the use of an automated system can send alerts to multiple patients. Technology is also used in patient engagement. Technology can support communications through multiple channels to connect with patients and improve patient behavior. Through the use of tools such as secure message on a patient portal, a secure text message to a mobile device or wearable device, doctors can receive patient data and monitor their patients anywhere and in real time. Other technologies such as telehealth systems used to treat patients over long distances, mobile devices to input and access patient data, and cloud computing, which is a cost-effective way to help providers store, manage, and organize patients' health records, are also supported technologies for population health management. Now let us look at the role of technology in preventive and promotive care. Intervention of various vaccines that reduce the risk of contracting various communicable diseases as well as risk factors have reduced the morbidity as well as mortality due to various communicable diseases like polio, pertussis, mumps, diphtheria, typhoid, etc. Similarly, various drugs strengthen the immune system and delay the onset of diseases which increase healthy life of individuals. Various innovative information technology solutions like mobile apps and fitness gadgets are playing an important role in improving the lifestyle as well as nutrition intake of people living in urban areas in developing countries. HMIS and surveillance data. HMIS and surveillance data help to monitor and improve population health. Technology for management of health information and technological aids that enable program implementers as well as policy makers to improve health and bring long-term change in reducing prevalence of diseases, strengthening the health system in care provision as well as improve health-seeking behavior of people. Technology may also be utilized to improve access to care in remote areas. Today, we have the technology to transfer large amounts of digital information effortlessly at a relatively low cost. It is easily possible to listen to a patient's heart remotely, look at and opine on an ECG, X-ray, CT scans, and other imaging data obtained several hundred miles away. While telemedicine holds considerable promise, we are yet to harness the true potential of this powerful tool to help people living in remote areas. Health technology assessment is an important tool developed by the World Health Organization to systematically evaluate properties, effects, and impacts of health technology and interventions. It is a multidisciplinary process to evaluate the social, economic, organizational, and ethical issues of a health intervention or health technology. The main purpose of conducting an assessment is to inform a policy decision making. It covers both the direct and indirect consequences of technologies and interventions, as well as their indirect or unintended consequences. Health technology assessment is a form of policy research that identifies policy issues, both long-term and short-term, assesses the impact of alternate courses of action, and presents findings. Its main purpose is to inform technology-related policy making in healthcare and thus improve the uptake of cost-effective new technologies and prevent the uptake of technologies that are of doubtful value for health system. One of the three complementary functions is to ensure the appropriate introduction and use of health technology. The other two components are regulation, which is concerned with safety and efficacy, and assessment of all significant intended as well as unintended consequences of the technology use and management, which is concerned with the procurement and maintenance of technology during its life cycle. The performance of health system is strengthened when the linkages and exchange among these elements are clearly differentiated but mutually supportive. Now let us look at the steps involved in health technology assessment. A health technology assessment can be characterized by three phases: assessment, appraisal, and decision making. In assessment, collation and critical review of scientific evidence is done. In appraisal, review of the assessment with consideration of all other factors like policy by the committee to make a recommendation is done. And in the decision-making phase, implementation of these recommendations is undertaken. Each of these phases comprises various structures and functions. The model of health technology assessment highlights the three phases and their interaction in the realm of science, policy, and population. Now let us look at the health technology assessment process. Most of the health technology assessments involve some form of the following basic steps. That is, identify the assessment topics, specify the assessment problem or questions, retrieve available relevant evidence, generate or collect new evidence, appraise or interpret quality of the evidence, integrate and synthesize this evidence, formulate findings and recommendations, disseminate findings and recommendations, and then monitor its impact. However, not all the health technology assessment programs conduct all these steps. Now let us look at some of the questions that may be asked in each of these steps. In the step of organization, the relevant questions that may be considered are: how is the HTA body regulated? What is the relationship with the government? Are there legal or policy constraints? Similarly, in the remit stage, the questions that may be considered are: what technologies require a decision? What assessments are required? How are the third parties, such as the patients, involved? What is the level of transparency and accountability? In the step of methods and processes, the questions that may be considered are as follows: what aspects or domains are assessed, for example, ethical or economic? How are analyses conducted? In the dissemination phase, some of the questions that may be asked are: to whom are the recommendations given? In what time frame? And what is the content of the communication? In the decision phase, some questions that may be considered are: is an expert committee required? What is the link to the decision makers? And what are the priorities of the decision makers? In the implementation stage, the questions that may be answered are: how are the decisions implemented? What is the result of a recommendation? And in the final, that is the impact stage, the questions that may be considered are: who is being impacted? What is a relevant measure of impact? What is the decision-making procedure? And what are the decision outputs? These are some of the important questions that may be considered for a HTA assessment. Now, let us look at technology and the cost of care. There are constant debates around the cost aspects and technology diffusion in health, and conflicting arguments are suggested by researchers depending on their assumptions for the use of technology. Technological change is often argued to be the central force behind the growth of healthcare spending. In India, like in most countries, healthcare is increasingly being driven by digital technology. Most medical equipments today run on digital platforms. Hospitals, clinics, and many other healthcare facilities are increasingly dependent on hospital information softwares. Yet, healthcare is becoming increasingly expensive and out of reach of the common man. Most literature from the developed countries, especially USA, suggests that technology is the main driver of cost in healthcare and advocates cost-benefit analysis of the new technologies before mainstreaming them in health system. On the other hand, studies from developing countries like India suggest that technology entails solution to improve access and equity in healthcare like telemedicine. To conclude, we can say that there is a rising interest in the use of technology for health across various sectors, and it presents great potential for innovation in population health approaches to reduce racial and ethnic health disparities. HTA is an important assessment tool supporting the decision-making at different levels of healthcare system. Its multidisciplinary nature and its strong reliance on transparent, scientific, rigorous methods. HTA helps in policy research, which is associated with needs, demands, and supply, and the success of HTA requires a balance between these three factors. Developing countries like India need to urgently develop a policy to regulate as well as guide the diffusion of health technology to ensure ethical use of technology and equity in provision of healthcare. Thank you.